Hello students, let's study sterilization and disinfection. Sterilization process by which all living microorganisms including viable spores are either destroyed or removed from an article or from the surface medium. Results in the reduction in more than 10 to 6 logs colony forming units of microorganisms and their spores. Disinfection process that destroys or removes most of, if not all, pathogenic organisms, but may not destroy bacterial spores. So result is reduction in 10 raised to 3 log CFU in most organisms and not spores, achieved by physical agent or chemical agent, usually used only in inanimate object, not on body surfaces. Factors for efficacy of sterilant or disinfectant: organism load, nature of organism, concentration of the disinfectant, contact time, temperature stability and relative humidity, biofilm which prevents the entry of disinfectant. Or property of ideal disinfectant is a broader microcidal activity, fast acting, not affected by environmental factors such as organic matter, non-toxic, compatible with surfaces, odorless or pleasant odor, economical and environmental friendly. The sterilant, which kills all bacterial spores, tubercle bacilli, non-enveloped viruses, fungi, vegetative bacteria, enveloped viruses. So examples are the physical methods: steam sterilizer, that is autoclave; dry heat sterilizer, that is hot air oven; filtration; radiation, ionizing and non-ionizing; others like incineration and microwave. In chemical method, ethylene oxide sterilizer, plasma sterilizer. So Spalding classification for medical devices. So critical device, that is high risk. So items that enter normally sterile sites. So recommended method is sterilization, and the medical instruments like surgical instruments, implants, prostheses, rigid endoscopes, syringes, needles. Semi-critical device, intermediate risk. Items in contact with mucous membrane or body fluid. The recommended method is disinfection, high-level disinfectants. Examples are respiratory equipment, non-invasive flexible endoscopes, bedpans, urine bottles. Non-critical, low-risk item in contact with intact skin. Disinfection, intermediate or low-level disinfectant. The examples are non-critical patient items, non-critical environmental surfaces. Hello students, let's study moist heat. So in that we will see autoclave in detail. So it also called as steam sterilizer. The principle: when water is heated in closed container, it produces vapor and then it causes vapor pressure. Then when water boils in closed container, the vapor pressure is increased more than the atmospheric pressure, and then it has a more penetrating power to kill the organisms. And the mechanism: killing of organisms by irreversible coagulation, denaturation of enzymes and proteins. The types of autoclave are horizontal when it is in large volume, and it is mainly used in CSSD department. And the vertical one is in small volume, used in most laboratories. The components: there are three main components: pressure chamber, lid and electrical heater. So pressure chamber is consists of the large cylinder, either vertical or horizontal. It is made up of metal or stainless steel, and it has a steam jacket, that is water compartment at the bottom. The lid: it has discharge tap for passage of air and steam, pressure gauge for the pressure measurement, and safety valve to remove the excess steam. An electrical heater: it is attached to the jacket that heats the water to produce steam. The working procedure: the materials to be sterilized are placed inside the cylinder. A steam jacket is filled with sufficient water, and then lid is closed with the help of clamps, and the electrical heater is put on. Now there are three phases. So first is conditioning phase, second is exposure phase, and third is the exhaust phase. So in conditioning phase, you have to give condition of temperature, pressure and time. That is temperature 121 degree Celsius, pressure 15 lbs and time 15 minutes. So after the water boils, the air in the chamber is completely displaced by the steam. So the steam pressure rises and then it reaches to the desired level, that is 15 lbs pressure. Then the safety valve opens and excess steam is removed out. Exposure phase, the holding period is for 15 minutes. Exhaust phase, so after the holding period is over, the electrical heater is switched off and the steam sterilizer is allowed to cool till it reaches the atmospheric pressure and then the material inside is removed. The care and maintenance of the autoclave. So we have to always put water in steam jacket. Do not forget to put off gas burner after the holding period is over. Never leave autoclave unattended when pressure is rising and never open the lid immediately after heating period is over. So we have to allow it to cool and then open the lid. Sterilization control, physical conditions like temperature, time and pressure, chemical indicators like external pack control that is autoclave type or Browey test or internal pack. The biological indicator spores of Geobacillus thermophilus are the best indicator which kill spores in which the spores are killed in 12 minutes at 121 degrees Celsius. Uses of autoclave. So there are mainly two uses, hospital uses and the laboratory uses. In hospital uses, the sterilization of surgical instruments, anesthetic equipments, dental instruments, implanted medical devices, surgical drapes and linen, biomedical waste treatment for disposal. Laboratory uses sterilization of glassware, test tubes, slides, pipettes, petri dishes used in the laboratory, sterilization of culture media for preparation, inoculated infected culture plates, killing of microorganisms and the spores. Flash sterilization, it is modification of conventional steam sterilization used for the emergency or during unplanned procedure. So it involves fast sterilization, that is temperature 134 degrees Celsius for 3 to 10 minutes for surgical instruments in unwrapped condition in steam sterilizer located close to the operation theater, and it is restricted for emergency situation. Disadvantage, not suitable for porous or cannulated instrument or implants because the instruments are not packed, so they remain wet following sterilization and there is high risk of recontamination. Dry heat. So in that examples are flaming, holding instruments to be sterilized in flame of the spirit lamp or Bunsen burner. Example, wire loop, points of the forceps, spatula, scalpel, needle, mounts of culture tubes, glass slides. Second method is incineration. It is physical method of sterilization in which material to be disposed of are kept in big dig and are burnt off. It is called incineration. It burns, that is sterilizes the anatomical waste and microbiology waste by providing very high temperature 800 to 1200 degrees Celsius, converting the waste into ash, fuel gas and heat. Uses in this is excellent method for rapidly disinfectant material such as soil dressing, infected dressing, bedding, pathological material, disposable syringes, gloves, hospital waste, lab waste, etc. Disadvantage, plastic material emits clouds of the black. The third example in dry heat is the hot air oven principle. When electricity is passed through heating coils, electrical energy is converted into heat energy. The temperature is 160 degrees Celsius and holding time is 2 hours. Uses dry sterilization of syringes, needles, drying of glassware, test tubes, petri dish slides, pipettes, heating of chemicals used for preparation of standards, sterilization of oil, grease, liquid paraffin. Sterilization control of the hot air oven, biological indicator, the spores of Bacillus atrophius. The uses of hot air oven, sterilization of egg media, sterilization of serum media, sterilization of sugar media. Filtration. So filtration acts by removing microorganisms, not by killing. There are two types of filters. Depth filter used as drinking water purifier. Membrane filter widely used in hospital. Bacterial filter size is pore size is 0.22 micrometer. Filtration of air, surgical, three-ply mask and respirators. HEPA filters, high efficiency particulate air filter, removes 99.7% of particles that have size of zero point 0.3 micrometer or more. ULPA filters, ultra low particulate penetration air, removes 99.999 particles that have size of 0.12 micrometer or larger. Filtration of liquid used for bacteriological examination of water in hospital settings, dialysis water. to remove bacteria from pharmaceutical fluids that are heat labile and cannot be purified by any other means. Radiation, ionizing and non-ionizing radiation. So ionizing radiation include cobalt 60 gamma rays or electron accelerators. Use low temperature sterilization method that has been used for a number of medical products, tissue for transplantation, pharmaceuticals, medical devices. Mechanism causes ionization of molecules in organisms leading to breakage of DNA. Advantage, high penetrating power and rapidly acting. Temperature is not raised, so it is also called cold sterilization. Disadvantage, high sterilization cost and may have deleterious effect on equipment made up of polyethylene. Sterilization control, efficacy of ionizing radiation checked by Bacillus pumilus. Non-ionizing radiation, infrared radiation technology, alternate method of sterilization for selected heat resistant instrument. Ultraviolet radiation does not achieve sterilization described under intermediate level disinfectant. Test for sterilizers, the indicators, physical indicator, time, temperature, pressure. Chemical indicator, they use heat or chemical sensitive material which undergo color change if the sterilization parameter, that is time, steam, quality, temperature for which it is issued is achieved. Common types are class 1, class 2, class 4 and class 5. Biological indicators, most reliable indicator as it uses bacterial spores to check the effectiveness of sterilization. Spores are highly resistant and will be destroyed only when the effective condition is achieved. Bacillus stereothermophilus for heat sterilizer, gas, plasma, hydrogen peroxide, and liquid acetic acid sterilizer.
Disinfection is the process that destroys or removes most of the pathogenic organisms but may or may not be the spores. So it is achieved by physical or chemical agents. So classification of chemical agents. So first type is alcohol group, that is examples ethyl alcohol, isopropyl alcohol, aldehyde, formaldehyde, glutaraldehyde, halogens, iodine, chlorine, phenol, cresol, lysol, chlorhexidine. Oxidizing agents, hydrogen peroxide. Dyes may be malachite green, crystal violet. Metallic salts of silver, copper, mercury. Gas sterilization by ETO, ethylene oxide, or plasma sterilization. Now let's see the level of sterilant or disinfectants according to their microbiological actions. So these are the 5 factors for the microbiological actions on vegetative bacteria, bacterial spores, tubercle bacilli, fungi, enveloped viruses and non-enveloped viruses. So sterilant is kills all the forms of the microorganisms. Then in disinfectants there are 3 types: high level, intermediate level and low level. So high level disinfectants kills all the morphological forms of the organisms except bacterial spores. Intermediate level do not kill or destroy bacterial spores, but they can damage all the microbiological forms. Low level, they do not kill bacterial spores and fungi plus minus, non-enveloped viruses plus minus. Factors influencing the efficacy of the disinfectant. So it is organism load, nature of the organism. So example, prions or bacterial spores are highly resistant than the other microorganisms like mycobacteria, viruses, fungi or vegetative bacteria. Then concentration. So optimal concentration is required. Then contact time, temperature, stability, relative humidity, biofilm formation which prevents entry of disinfectant. So these are all the factors. An ideal disinfectant should be broader microcidal activity, fast acting, not affected by the organic matter, non-toxic, then compatible with the material, odorless and economical. The antiseptics is a type of disinfectant which is safe to apply on the body surface, that is skin and mucosa, which results in the destruction of the organisms. Then cleaning or decontamination is the reduction in the pathogenic microbial population to a level at which items are considered as safe without protective attire. Spaulding's classification of medical devices. So they are categorized into the critical device high risk, semi-critical device that is intermediate risk, and non-critical device that is low risk. So critical device is item that enter a normally sterile site, so they are invasive. The examples are surgical instruments, implants, prostheses, rigid endoscopes, syringes, needles. So the recommended method is sterilization. Semi-critical device, they are in contact with the mucous membrane or body fluids, but they do not enter. So they are respiratory equipments, non-invasive flexible endoscopes, bed pans, urine bottles. So the recommended method is disinfection, that is high level disinfectants. Non-critical or low risk devices, they are in contact with the intact skin. So non-critical patient items like an environmental surfaces. So the method of recommendation is the disinfection, that is intermediate level or low level disinfection. Agents used in the hospital for achieving sterilization, disinfection and cleaning. So they are divided into the high level, intermediate level, low level and agents of the cleaning. So high level disinfectants, the examples are aldehydes, in that formaldehyde and glutaraldehyde, peracetic acid and hydrogen peroxide. Intermediate level disinfectants are alcohols, example ethyl alcohol, isopropyl alcohol, phenols, then cresol, lysol, halogens, iodine and chlorine. Low level disinfectants, quaternary ammonium compounds and chlorhexidine. Agents of cleaning are enzymatic solution, detergent, soap, either antimicrobial or plain soap. So let's see the disinfectant. So first is high level disinfectant, so capable of killing all the microorganisms plus bacterial spores. So first is the aldehyde, commonly used are formaldehyde, glutaraldehyde. So mechanism is combine with nucleic acids, proteins and inactivate them. So the formaldehyde is excellent high level disinfectant. Uses, it is largely restricted to non-patient care area for preservation of anatomical specimens, histopathological specimens and stool specimen. The fumigation of OT is nowadays practice not used. Disadvantages, it is irritating and pungent odor and potential carcinogen, corrosive, causes skin irritation and asthma when inhaled. Glutaraldehyde, so it is used for the semi-critical items like endoscopes, cystoscopes. So it is also used for aerial disinfection and cleaning, that is fogging and cleaning of floor and surfaces of the critical areas. So example bacillocid is used in the concentration 2%, it is example Sidex. Duration is 20 minutes and for spores is 10 to 14 hours. Advantages, it is active in the organic matter. Disadvantages, pungent odor, can produce eye irritation and asthma and contact dermatitis. H2O2, hydrogen peroxide, mechanism of action, it produces hydroxyl free radicals which are toxic and attack the various cell components. The uses are sporicidal, more than the 4 to 5% concentration. 3% H2O2 for the environmental surface disinfection, fogging and wound cleaning. 3 to 6% H2O2 for disinfection of the soft contact lenses, ventilator, endoscopes. Say 6 to 7.5% H2O2 as a chemical sterilant in plasma sterilization. Vaporized H2O2 used in the industrial sterilization of medical devices and for decontamination of the large and small areas. Advantages, rapid in action, non-toxic and active in the presence of organic material. Disadvantages, expensive, can cause chemical irritation, corneal damage, should be stored properly in the dark containers. Second is the intermediate level disinfectant. Example is the alcohol. So it can be used in preparations like ethyl alcohol, isopropyl alcohol, most popular alcohol in the hospitals. Action, rapidly bactericidal except spores. Action by denaturation of the proteins. Uses, alcohol mostly used in the concentration of 60 to 80%, can be used as the hand rub, example sterilium. Disinfecting smaller non-critical instruments like thermometer, small medical items like vaccine vials or external surfaces of the equipment, stethoscope. Disinfection of non-critical surfaces, lab bench area. Disadvantages, flammable, must be stored in the cool ventilated area, evaporate rapidly, may damage the tips and lenses inactivated by the organic matter. Second is the phenols. So phenol carbolic acid, first widely used as an antiseptic by Joseph Lister. Mechanism of action: disruption of cell wall and cell proteins. So there are two uses: used as a disinfectant, example cresol or lysol. So it is used as a disinfection of the environmental surfaces, that is bedside tables, bed rails, laboratory surfaces, non-critical medical devices. It is toxic to skin, so not used as a antiseptics. 5% phenol can be used for the disinfection of the sputum specimen as a mycobactericidal. Used as an antiseptic, so it is chloroxylenol. It is a active ingredient of the Dettol. So widely used as an antiseptic. And advantages: it is active in the organic matter. Disadvantages: may cause hyperbilirubinemia in the infants. Third is the halogens. So iodine and chlorine are the examples. They have antimicrobial activity. So first is iodine. Mechanism is disruption of protein and nucleic acid. So there are two preparations: tincture iodine, 2% iodine in potassium iodide, and iodophore, it is povidone iodine, example is betadine. So it is used as an antiseptic. So 5% topical solution and ointment for wound healing, 7.5% for the hand scrub, 10% for the surgical skin preparation, 1% oral antiseptics or for as a mouthwash, and as a disinfectant for the medical equipment. So it is also used in hydrotherapy of the tanks. So next is the chlorine and hypochlorite. Mechanism of action is the oxidation of cellular materials and destruction of the vegetative bacteria and fungi. So there are two preparations: free chlorine and hypochlorite. Hypochlorite is available in liquid form, that is sodium hypochlorite or household bleach, and powder form, calcium hypochlorite or bleaching powder. So uses of the free chlorine: disinfection of the municipal water supplies and swimming pool water, also in the dairy and food industries. Uses of the sodium hypochlorite: it is available in the concentration of 5 to 6%. It should be used in appropriate dilutions for disinfection of various hospital supplies. Contact time 10 to 20 minutes. Advantages: it is broad spectrum sporicidal, rapid and non-inflammable and low cost, widely available. Disadvantages: inactivated by the organic matter, toxic to skin, mucosa, carcinogenic. So daily preparation may cause corrosive damages to the fabrics, carpets. Third type is the low level disinfectant. It destroys all the vegetative and enveloped viruses. Other actions is invariable. So example, quaternary ammonium compounds. So mechanism is by producing enzymes, denaturation of the cell proteins and cell membrane. The preparations are the benzyl ammonium chloride, but it is not acting in presence of hard water. But newer generation quaternary ammonium compounds are active in hard water and better compatible. Cleaning agent. So cleaning is important step for the before disinfectants applied to remove organic matter, because few reagents do not act in the presence of organic matter. So the examples are enzymatic cleaners. So they contain enzymes like amylase, lipase and protease and all. Cleaning chemicals, so they are detergents. So manual cleaning and automatic mechanical cleaning like ultrasonic washers, disinfectors. Test for chemical disinfectants to check the efficacy, potency of the disinfectants. So the various methods are available. So first is a Riddle-Walker or phenol coefficient test. Second is the Chick-Martin test. Third is the capacity, that is Kelsey-Sykes test. And fourth is the in use, that is Kelsey-Maurer test. Ethylene oxide or ETO sterilizer most commonly used in the CSSD. Mechanism is microbicidal, where it causes disruption of all the cell components, that is cell proteins, DNA and RNA. The sterilization cycle you have to carry out in the 3 stages. So first preconditioning, then sterilization and then aeration. Preconditioning, air is replaced by the vacuum. Sterilization, ATO is allowed in the chamber, so gas concentration, temperature, humidity, exposure time should be noted. Then aeration, that is degassing, so extensive aeration to remove residual ETO because ETO is a toxic and carcinogenic. The uses used by CSSD to sterilize critical items, sometimes semi-critical items that are moisture or heat sensitive and cannot be sterilized by steam sterilization. So examples: heart-lung machine, components, sutures, catheters, stents, respirators and dental equipment. Advantages: suitable for the heat sensitive items. It has high penetration power, highly diffusible, penetrates areas that cannot be reached by the steam, non-corrosive to plastic, metal and rubber material. Disadvantages: highly inflammable, irritant, explosive and carcinogenic. So ETO is usually supplied in 10 to 20% concentration mixed with inert gases like either CO2. The long duration of cycle 12 to 14 hours. High cost of instrument and consumable. Sterilization control: spores of Bacillus atrophius is the biological indicator. Second is the plasma sterilization. So it is a gaseous state consisting of ions, photons and electrons and free radicals such as O and OH. So it is the most commonly used device in the CSSD to create plasma state. So process: first vacuum is created, then second chemical sterilant, that is H2O2, is vaporized for 50 minutes at low temperature 37 to 44 degrees Celsius. Then gas plasma is produced by the applying electric field. Last step: excess gas is removed. No aeration required because byproducts are not toxic. Cycle duration 75 minutes. Uses by CSSD for sterilization of materials and devices that cannot be tolerating the high temperature and humidity of steam sterilizer. Example: plastics, electrical devices, corrosion susceptible metals such as arthroscope. Precautions or disadvantages: so my item should be dried before loading. Then linen or paper or cellulose liquid cannot be processed, may not penetrate well, especially in channels or devices for with long lumen. Has small chamber, cannot be used for bulky amounts, expensive equipment and packing materials. Sterilization control is the biological indicator: spores of Bacillus thermophilus. So these charts suggest the summary of the all disinfectants. So glutaraldehyde, Sidex aldehyde type 2%, mostly for the sterilization of all the scopes. Povidone iodine, halogen group 2 to 10%. It is used mostly as an antiseptic, wound clinic and mouthwash. Dettol, phenolics group, mostly antiseptic for the wound. Hypochlorite, so it is 1 to 5%, mostly 1% hand washing, 4% disinfectant. Hydrogen peroxide, oxidizing agent, 3 to 5%, disinfection of the wound and environmental surfaces, mainly used for the fogging. Formalin aldehyde group 10%, preservation of anatomical and histopathology specimens. Phenol carbolic acid 5%, disinfection of environmental surfaces, floor, walls, disinfection of the sputum, skin, antiseptic. Hope you find this session useful for your understanding and for your exams. Thank you.